I'm Dr. Sarita Randive, a practicing pediatrician, and my area of practice is JB Nagar, Andheri East. So today in the continuing education knowledge series, I'm going to delve on the topic of abnormal head shapes. The reason for choosing this particular topic is because it is a fairly common condition, and in addition, this innocuous condition may cause considerable anxiety in parents and caregivers. So to know what is normal and abnormal, let's see what the normal shape of a head or skull of a newborn baby is. So normally the newborn baby's head is egg-shaped, that is, it is wider at the back than the front. The abnormal head shapes that I'm going to discuss today are brachycephaly and plagiocephaly. The brachycephaly is essentially uniform flattening of the head, as a result of which the width of the back of the head increases more compared to the length of the head. In case of plagiocephaly, it is asymmetrical shape of the head because of unilateral flattening of one side of the head. So who are the at-risk babies? The at-risk babies would be those who are involved in multiple pregnancy, for example, twins. The second condition is if your baby is born with a wry neck or torticollis. Also, placing the child for prolonged periods on firm mattresses, as well as excessive usage of convenience devices, for instance your car seats. Also, the prams and strollers for very prolonged periods of time may put your child at risk. Also, if the baby is squashed in the womb in a condition known as oligohydramnios, and the preterm babies, that is the babies who are born a little early than normal, that is before 37 weeks of gestation. So let me talk about the tips where we can relieve the pressure on the head. Try to prevent the baby from lying on flat firm mattresses for prolonged period. How can you do this? One is by giving tummy time. So tummy time essentially is placing the baby on the tummy so that you not only improve the milestones but also the neuromusculature of the baby, and thereby you relieve the pressure which is there for prolonged periods. Secondly, the danglers and the toys in the cot can be changed so that you enable and ensure that the baby changes the position and thereby relieves pressure on one side. Also, try to change the position while holding and feeding the baby. Instead of using convenience devices, you can use a front carrier or a cloth sling. And in case of wry neck or torticollis, you can also see to it that you take care of this condition by giving your child regular physiotherapy. Now, the other set of helping things are your medically designed pillows, but mind it, the exact effect of these pillows is not known. Typically, this has a depression in the center, and you have to ensure that it is always supervised. Also, remember that tummy time is always supervised. Now, coming to helmets and headbands, these devices are used in certain cases where there are moderate to severe cases of head flattening. They see to it that pressure is relieved from the flattened part by putting pressure on the bulging part, eventually ensuring that the skull develops normally. The downside of these helmets are, one is it is not very easily available, especially in our country. It comes at a whopping cost. You have to intensively and aggressively monitor the condition. It has to be worn for about 23 hours per day, and it may cause considerable psychological distress to the wearer as well as the caretaker. So to summarize, with these tips, you will see a lot of improvement over time, and you will hardly see any flattening visible by the time the child is mobile. In moderate to severe cases, you may not really get the desired perfect normal shape, but with the growth of the hair and as the child becomes mobile, this condition is barely noticeable. In my practice, I've barely seen kids facing teasing or any kind of problems by the time they reach their school age. Please remember that this abnormal head shape is not going to interfere with the developmental milestones of your baby, not going to cause any pain to the baby. So I hope these tips will help you. For any further guidance, do feel free to contact me on my Instagram ID, email, or visit me in person.